Today we're going to be looking at evaluating methods. So these kinds of questions come up relatively often, where they ask you to look at a specific method and kind of assess its usefulness within that area of psychology. Obviously our focus is cognitive today, so it's a cognitive method we're going to be having a look at. So here's our question. Let's give you a chance to have a read of it and see what you think. So here's our question. We've got to think, what's the command word? Well, the command word here is assess. And we'll come back to what we think that means later on. The next thing we've got to consider is, what's the key term? So the key term here is case studies. That's what we're thinking about. And then we've got to look at what area of psychology are we focusing on here. Well, you know that we're looking at memory, which is linked to cognitive. So once we've established those things, then we can start thinking about the way we're going to answer this kind of question. So what we'd think about what the layout would be for this kind of question. How would it be structured? We know there's going to be an A1 paragraph, because in 8 markers there always is. Although obviously the way we structure that A1 paragraph varies from 8 marker to 8 marker. With this case, what's going to constitute our A01? Looking at the kind of the two key terms here, we've got case studies and human memory. You'd be forgiven for thinking that maybe we need to talk about memory a bit here. But clearly the area they want us to focus on is case studies. So that's going to be what mainly constitutes our A01, a description and discussion of what case studies are. So now what we've got to do is think about the literal layout of our essay. So first of all, we're going to have an A01, what is a case study? And making sure we relate that to memory, because that's what we're being asked to assess here. We're not looking at case studies in clinical or case studies somewhere else. We're looking specifically at case studies for human memory. Also important to point out, yes, this isn't cognitive. Yes, it is about human memory. It is about case studies. It is not just about the study of patient HM. You cannot spend your whole essay talking about Henry Molaison. We're going to come to that later when we look at the examiner report comments. Then we've done our A01. We've kind of nailed down what a case study is. We need to go to a strength of case studies with a counter argument, and then, as usual, a weakness of case studies with a counter argument. One of the things that people fall down on here is they don't link their counter argument to the argument that they've made. So if you're going to say that an issue with case studies is a lack of generalizability, it's not really reasonable to counter argue with an increase in validity. You're kind of making a different point there. You could counter argue about the quality of the application of case studies, because that is a direct counter argument to generalizability. Yes, you can't necessarily apply it to everybody, but the people you can apply it to, it can be very useful for. That's a reasonable counter argument. So I've got these examiner comments here. So this is taken from the examiner's report on the paper this is drawn from. I'm pretty sure it's the October 2020 paper, so you can kind of have a look at it for yourself. But you can see the main issues that he's flagging are things like relying heavily on describing and evaluating the case studies of Henry Molaison rather than describing the features of case studies. So, and that's locking them in. As you can tell here, they're saying they could not reach levels 3 and 4. You're getting stuck with 4 marks for this question then, if you're just talking about Henry Molaison. And considering the amount of time people invest in 8 markers, that's not a very good return. If you're going for those higher grades, you really want to get into band 3 and band 4. Interestingly, the examiner's linked to investigations with Alzheimer's, so he's talked about the fact that case studies take place over time and significant periods of time, so you can look at things like degradation of memory as well as illnesses like Alzheimer's. So here we are again, time for you to have a go. Remember, exactly 12 minutes. Please don't run over. As soon as that clock hits 12 minutes, you need to stop it and stop what you're writing, and that's what you're going to mark. If you're worried you're not getting enough down, you need to kind of think about what could you have cut out of your A01s, how could you have structured your A03 slightly differently to be more concise. But there's absolutely no point in you spending 14 or 15 minutes on one of these 8 mark questions, because in the exam you're just going to end up losing a whole question's worth of marks, which kind of defeats the object of what we're going for here. So here's the mark scheme, as usual, slightly misleading, but kind of gives you some idea of the kind of content you need to include. You've got those clear A01s talking about what case studies are for and the kind of methods that you can use within a case study, looking at development over time, increased validity, all those kinds of things. When you're looking at the AO3 strengths and weaknesses, you can be talking about sort of an increase in subjectivity in the researcher as they spend more time around the patient, all those kinds of really specific to case study things. Try not to fall into broad generalities about generalizability and just saying they're not very generalizable because you're only looking at one person. That's true, but that's not going to get you band 4. Really dig into what the strengths and weaknesses are of this method. You know enough about it to be able to talk about it in some detail. Talk about it in some detail. Okay, so the final thing that we're going to look at is the bandings. You can see they're relatively similar to the evaluate bandings. They're not miles different. They talk about assessment rather than evaluation, and that's about considering the value of something when you assess it, rather than considering its strengths and weaknesses. And importantly, you have to come to a final assessment at the end. So if we look for the differences, again, we've got that same band 2, band 3, band 4 for the AO1, with the mostly accurate developing into accurate and becoming accurate and thorough for level 4. Again, the way to get that is to make it appear to the examiner that you know absolutely everything that there is to know about case studies, but you've only discussed a few things, so those are the things related to your assessment. We're back here with the assessment, talking about things like relevant factual material, leading to a generic or superficial assessment being presented. Generally, that's where most people end up, to be perfectly honest with these kinds of questions. When we come to this one about grasping or understanding of competing arguments and trying to grasp their significance, this is a relatively subjective thing. What you don't want is for your marker to be considering whether you are fitting between band 2 or band 3. They should be easily citing you in band 3 and then thinking, are they actually going up to the band 4, where they have that logical chain of reasoning throughout and awareness of significance of competing arguments or factors. I mean, what this would look like in your essay is saying things like taking an ideographic approach will benefit in some ways because you can look specifically at that individual in significant detail and get a really full understanding and, very importantly, a full internally valid understanding of what's going on with that individual. And then your counter argument leading to something along the lines of the lack of ability to take that particular example and generalize it to lots of other people is going to mean that perhaps there's some weaknesses to the case study style. But that doesn't necessarily mean that the results are entirely useful, and then you kind of go on to application. So you've got that kind of logical chain of reasoning, and you're making sure that you're aware of the significance of the competing arguments. They're not just kind of stated and then thrown away. So hopefully you've had a good go at that kind of question. As I've said before, if you want me to mark it, you're more than welcome to ping it over to me and I'll have a look at it. But always best to come see me in person and I'll have a look at it actually in the lesson. And that's always really useful. Right, I'll see you all again next week.